Hello, my name's Dr. Thomas Robinson, and today I'm going to present a new paper that looks comparatively at the public's preferences for vaccine prioritisation around the world. This paper is joint work with Raymond Dutch at the University of Oxford and Philip Clark, who's the PI of the wider project that I'll introduce in a couple of slides' time, as well as a whole range of fantastic colleagues from around the world who contributed to various aspects of this project. The paper itself is available on medRxiv, and I've attached the link on this cover slide here, and I'll put it in the description below as well. The last 12 months have been marked by the rapid development and production of vaccines aimed at combating COVID-19. By the beginning of this year, there had been over 100 potential vaccines in various stages of research, and some of these have now received approval as safe and effective for human vaccination. But with these vaccinations beginning, all governments face an unenviable problem. The vaccines as they currently stand are scarce, and governments must decide who to vaccinate first. And whilst doing so, they must reckon with the fact that they're facing both economic and health-related emergencies that will affect how and who should receive the vaccine. And all of this is going on whilst public confidence in vaccination programs in general and for the COVID-19 vaccine specifically are quite fragile. So, who should governments vaccinate first? Now, of course, there are multiple different ways that the COVID vaccine could be allocated, but it's really important to remember that vaccines are a public good. And since they're a public good, the public has expectations over how those vaccinations should be provided. Now, authorities and indeed the public are nearly universal in their agreement that the clinically vulnerable should be targeted first for vaccinations. But once we get beyond these clinically vulnerable individuals, there is vast disagreement between countries over who should receive the vaccine next. And while calls have been made for the public to have a say in who gets the COVID-19 vaccine when, to date we have very limited empirical evidence on the public's preferences for this vaccination schedule. And so this is where the CANDOR project comes in, which seeks to understand public opinion on COVID-19 vaccinations around the world. And this project as a whole is being led by Professor Philip Clark at the University of Oxford. The CANDOR project fielded surveys in 13 countries across all continents, barring Antarctica, from Canada through to Chile, through to Uganda, Australia, China, India, and several Western European countries too. And overall, it was focused on understanding what strategies national publics think are equitable and fair when it comes to COVID-19 vaccinations. In this paper, we focus specifically on the conjoint experiment embedded within the wider survey. This conjoint experiment is a discrete choice design in which we asked respondents to pick between two hypothetical potential recipients of the COVID-19 vaccine. We then randomised the various attributes of these two profiles, specifically looking at their respective vulnerability to the COVID-19 disease, their risk of transmitting this disease to others, their occupation, income, and also age. In total, we were able to survey 15,500 people from around the world, which included about 1,200 subjects per country within the study. And as a result, we were able to present over 248,500 different hypothetical profiles to these respondents. We find strongly consistent effects around the globe. Regardless of the country, subjects want to vaccinate those older individuals and those in key worker positions, particularly within healthcare and the emergency services, and also to vaccinate those with higher risks of both transmission and vulnerability to COVID-19. We also interestingly find evidence of subjects preferring to vaccinate those on lower incomes, and this effect holds across all but one country in our sample. We then pooled our results across countries and estimated different models based on a variety of different covariate factors, including age, income, and gender. And we find that actually there are no notable differences between these subgroup estimates, suggesting that really there are a common set of preferences across the globe towards vaccine prioritisation. Finally, we asked subjects about their preferred mode for the allocation of the vaccine. And as you can see, across all 13 countries surveyed, overwhelmingly citizens want the government to be providing the only source of vaccines during the pandemic. Finally, I'd just like to say thank you to the various research institutions and funders that have provided support for this project, and to Matteo and Mario for hosting this conference.